It's one thing to be listened to. It's another thing to be listened to and then for what you've said to be actioned on. It's not tokenistic. It's not engagement. It's actual genuine involvement.
Hello and welcome to our HSE Talking Health and Wellbeing podcast series. My name is Noreen Turley and thank you for joining us for this episode. Today we're going to discuss the HSE's Patient Partnership, and we're joined by Anne Lawler, who is the chairperson of the HSE's Patient Forum and long-time active patient advocate and founder of the 22Q Charity Ireland. Welcome, Anne. We also have Joe Ryan with us, and Joe is the HSE National Director for Operational Performance and Integration, including responsibility for leading this key area of patient service and user engagement. So thank you very much for joining us today on our podcast series. I think this is a really important podcast that we're having today, and we'll have some very interesting discussions. And just to kick off, Anne, I wanted to ask you to tell me a little bit about the Patient Partnership and why you got involved.
I got involved because of my own personal lived experience, Nolene, because I have a daughter who was diagnosed with a rare condition in 1998 when she was 15. And there was very little information and there was no mechanism where I could approach the HSE and say, hello, this is what I'm dealing with. Could you help me? That was way back in 1998, as I said. And to various organisations and going to meetings and all of that, I came across the HSE Patient Forum. And I'm a member of the forum since 2015. And it's gradually evolved from there, I suppose, to where it is today. It's far different today than it was back then. I think back then it was to find patient advocates to join in things. So joining in is not the same for me as being involved because of my personal experience, because I went on to set up the 22Q Irish charity, and I discovered through all of that things were not joined up. I needed integrated care and I needed to work with people who understood our situation. And then the families that I engaged with all around the country, our families are. So because I think when you have that lived experience and clinical expertise and you bring them together, you get a very, very good outcome. And to me, that was partnership, and not just partnership, but it was active partnership. So we went on to begin a kind of a long journey, a business case for the HSE to get a clinic and then to get a care coordinator. And it's because of my lived experience that I knew a care coordinator would be of huge benefit, especially to the mothers, because mothers, this is a very complex condition with lots of disciplines involved. And then you also have special education needs and mental health needs. So very complex. And to get that across to people who are going to care for our children, they needed to hear us and we needed to hear them.
And did being part of the Patient Forum then give you a platform to speak to people about that?
It did in some ways, yes, because I think 22Q is regarded as a rare disease, and I think the level of awareness and understanding of rare diseases is not where it could be.
Yeah.
I wanted to make things better. I think if you talk to any patient advocate and why they get involved, they will say, because I don't want this to happen to anybody. And you're trying to make things better for the people coming behind you.
Yeah, that's really good. And Joe, what would you say inspired the HSE to start this patient forum or to take on patient partnership and involvement?
I think the movement, as Anne said, it started back in 2015 when the forum kind of got going in the first place. As Anne said, it probably in its initial stages was a bit more, you would, pre-cook things and go to the patient and say, what do you think? And when it came to me under the last reorganisation in the HSE, which is about 2.5 years ago, I guess now, slightly funny story. I went in with nearly 40 years in the tech industry and in health, being kind of the process improvement type of guy. And I went to the forum and said, here's what I think. And I started to present a very process thing. And I could actually feel the tension in the room.
Okay.
And I stopped. And I just stopped and I put my hands up and I said, I've gotten this terribly wrong. Now, can I start again? And so I was forgiven. I think I was forgiven for being honest enough to say I got it wrong really more than anything else. But we started again and I shut up and listened. And we then started the process, and with a couple of people in my own team, Aileen and Des, who did a fabulous job around, design thinking and facilitating, quite broad, large group of patient advocates and HSE staff to rethink what do we really mean by what was known as patient engagement, patient and service user engagement at the time, and really have redefined it to be around involvement and partnership. And they're very different. That's not where you pre-cook anything. It's where your patients and your service users join in the actual design process of how we're going to structure ourselves, of how we're going to deliver services, of how we're going to do digital innovation and bringing in electronic health records and all of the other things that we want to do in the health service, that we involve our patients in the design of it, in the implementation of it, and then in evaluating how good it is and how much it helps our performance and how the quality of the services we deliver. It's a much more invested space and much more involved.
Yeah. And on a day-to-day basis then, for somebody like you who is involved, what does it look like? What is the commitment? Are you on different groups, or how does it work?
Yeah, it's a significant, or it can be a significant involvement. We have a vision document now in the forum. I have a super co-chair, Laura Kavanagh, and she works for IPOSI. That's another organisation. And she's very orderly in her thinking around these things about governance and terms of reference and all of that. So we work very well together. Some people want to be engaged to a lesser degree. I see this with my own families, like when the children are very small, you just don't have the time. And I have more time now, and I've become heavily invested in it. It's just the way my own journey has evolved over time. But I do think it makes a difference, and it's the difference that's needed, because I've seen the benefits of it personally with our own 22Q community. How we work in partnership with the clinic and the clinicians, and we're in constant contact, and we co-design things together, the best care pathway.
Yeah. And Joe, is that a good example then?
It is. I mean, there's a variety of ways you can be involved. We have a panel of people who are, patients or service users, or maybe members of organizations that represent various groupings within that. And that's about 75 people. And they work with our own internal team to identify projects and initiatives that are being designed. We used to have to try and actively go out and get them involved in that. Now all of the people, not all, but most of the people now developing new services are coming to us early saying, can you assign us some people who will work with us.
Good. So somebody has a project at local level and say we need a patient to check this out to make sure it's okay, that we're going the right track.
And help us design it, right?
And help you design it.
And it can be, it can be a small time commitment, or it can be a much more intense time commitment to it. The 75 is now, stretched, and particularly as we move to regions, because in each of the regions we will have, and this was another one of the very big projects that patients were very much at the heart of the design of the regions themselves, but also in particular the patient and service user involvement and partnership models at the regional level. And so as regions evolve, the whole idea of the regions is that they do structure things and develop initiatives that meet the specific population needs in their region. They're going to need patient partners to be involved in what they're doing. So we need more people.
And just for the listener, do you want to explain a little bit about what we mean by the 6 regions? Because everybody may not have heard that just yet.
Yeah, so under Sláinte Care, one of the big initiatives has been to, if you like, deconstruct a little that big centre of the HSE, and everything seemed very national and centrist within the HSE, and devolving that now to 6 regions around the country. So you'll have the West Northwest, you'll have the Midwest, you'll have the Southwest, you have Dublin South and Southeast, you have Dublin Midlands, and you have Dublin North and Northeast. Okay. And they're big regions in and of themselves. They will have a senior, what's called a regional executive officer, who is, if you like, the CEO of that particular region. Yeah. And they'll have all of the functions devolved to them. So they will be able to plan and deliver services in whatever way is meeting the need of that more local population, and moving away from that kind of very centre national type of way.
The patient partnership approach would be used in all of these areas.
Oh, it's absolutely.
And the patient would be there at the very beginning to help design services for the patients in that area. Would that be right?
Yeah, that's it. There will be 6 patient councils that will advise at the highest level within the region, and they'll feed up to the national forum and council. We have patient advocates who are on our board. We have patient advocates who are on our board committees. patient and service users will be at every single level of the HSE contributing to how we design and deliver our services.
Yeah. And if somebody was listening today and they want to, they can just go to hse.ie and
look up patient partnership or patient involvement or patient engagement. And that'll develop as we go, and the regional sites will develop as well.
Yeah. And Anne, what difference do you think having the patient partnership within the HSE has made? You were joined in 2015. What are the changes and what changes do you see coming down the line?
Joe mentioned there about the first time he came into the forum and eventually put up his hands and said, okay, I got this wrong. There's a difference.
That was a very brave thing to do, Joe.
Exceptionally brave. It was, but it started a very good working relationship.
Great.
It's one thing to be listened to. It's another thing to be listened to and then for what you've said to be actioned on.
Yeah.
So I would say, especially since maybe the last 2 years, Joe, have been really different for me. There's a different feel. It's not tokenistic. It's not engagement. It's actual genuine involvement.
And what switched? What's changed?
I'm not too sure. I'm not too sure. Maybe it's born out of the knowledge that there's a lot good in our health service, but there's also not a lot that's not going right. And to involve the patient and the service user just might make that much needed difference. I remember too when the health regions folk came in, Ray Bonner and Joe Short, and somewhat similar thing happened. You know, they gave us this presentation and we said, no, but you haven't done this and you haven't thought of that, and they took it on board. And not only did they take it on board, they actually put it into the finished document. That was quite a wow moment for me anyway, because when something is actioned, then you know there's a difference, because we have a lot of really good documents. You know, Sláinte Care is wonderful, but sometimes it's hard to action them, or they're not actioned, you know. So for me, that's the change.
That's brilliant, because very often, Joe, we see this whole thing as a them and us, and you're fighting against this huge organisation, and that's the HSE.
Let's be honest, and the best thing is to be honest. And maybe the moment, my Saul in the road to Damascus moment with the patients and service users maybe was a sign that, you know, the whole organisation is going through that. There was a time, and probably even to today in parts, people look at the HSE as being this sort of monolithic, inaccessible and deliberately inaccessible and defensive thing, right? And it's difficult for a large state organisation, particularly in the services we're in, to become more open and involved. I mean, it's just, you know, the culture has to shift. Now, culture is going to be part of my job in the new world, and my job's shifting in the coming months to be...
There's another podcast for you.
There's another... Yeah, but to me, there's a big symbiosis between culture and patient engagement, you know, and so that the organization's culture should be directly informed. If we're a patient-centric, and that's an oft-used word, not often lived, and I think that's what we need to become. And I think the organization felt that. So we felt we needed a change and a rejuvenation of how we do that. And so the shift started a couple of years ago and that's when we started to redesign and work with the patients to say, what does it mean? How can we make this better? How can we actually get to a point where, and Anne coined this term, which is our HSE.
Yeah.
We want to get there. We want everybody in the country to believe that it's their HSE. People will understandably eye roll when they hear that because it feels all kind of nicey, right? But it is genuinely where we're trying to create this movement. And you change the culture of an organization by creating movement. You don't do it by creating a document or a policy. You create a movement for better. That movement started a long time ago with things like, you know, values in action and other things that we need to rejuvenate. We need to keep trying. I mean, one thing is for sure, change like this doesn't happen just in one moment. You have to be relentless. And we do drift off track, and then we pull ourselves back and go again. And, you know, it's people like Anne are testament to that just constant, relentless striving to make things better. We've got, you know, other people like Anne in the movement who are absolutely laser focused on making things better, not only because they're inspired because of their own lived experience, but actually they want other people to experience a better health service. And that's what we're all about.
Yeah. I think it's really important, and for people to know that there is patient involvement in the health service, because in a way you're representing all of those other patients around the country and trying to help their experiences to be better, you know. Would you encourage people to be involved in this whole patient engagement?
Yes, if they can. For me, it's about relationship. a partnership is a relationship, and you learn things from each other. We have to be prepared to hear each other. One of the great learnings for me was hearing about the constraints that maybe clinicians have, or nurses, or therapists, or sometimes even politicians. You know, everybody works under certain constraints. And I think to develop the relationship is really important. It's always been important for me in my own work. It carries on then into any other work that I do, because I think to reach that common ground, you have to have a kind of a mutual, respectful relationship. And I think that's what we're developing here. I would say this is a new space, and what we're doing is building the foundation. I mean, if you want a good, solid house, you have to put in a good, solid foundation. And it's not glamorous by no means. As Joe said, it's relentless. It's, it's tiring. You can get knocked back. You get resistance. A lot of people are resistant to change, but that's the way it is for me personally. And I would like to think that I'm representing a good amount of people, especially children. We should leave no child behind. Yeah.
It sounds like the foundation is very well built over the last couple of years. It's obviously taken this length of time since 2015 to get to here. And where do you see it moving from now, Joe?
The CEO has made it crystal clear. It's an integral part of what he is trying to achieve in his tenure at the HSE for whatever number of years that's going to be. In the new structure, he has brought patient and service user directly into his office. So I will report directly to him with that function and the culture function and the risk and compliance function. So, and I see a synergy between all of that.
Yeah.
Right. And it's a cornerstone of everything he's doing. He is, for Bernard, it's the patient has to be, the patient service user, because it's not all only patients that we serve, that they are absolutely at the center of everything we do. And it's the why we come to work. That's where it has to be. Part of any big cultural change like that, you have to have clear commitment to that at the very top of the organization. And between the CEO and our board, I think we have a very strong commitment to it. I'm encouraged constantly by the CEO, just go for it, push on, make it happen. When you meet resistance, be what you need to be, but know that you've got the backup of the organization in doing the right thing. Look, everybody wants to do the right thing. You need to get past this notion that a paternalistic health service is the best thing for everybody. The world has moved on from that. And most of the services we have moved on from that. Organizationally, we need to be seen to have moved on from that. And so that just takes effort and time and everybody to become part of the movement to change.
And Joe, when I was looking at the number of people and the number of organisations that are involved in the patient partnership, I would also think that everybody has their own agenda that they bring. Obviously, that's how they got involved. They have their own story and they have their own agenda. So is it difficult to get people to open their eyes? Anna's smiling at me here now. So is it difficult to get people to open their eyes and see the bigger picture, not just that one aspect that they really want to get change in?
It can be. It can be, most definitely, yes. But again, I'd go back to the common ground piece. If you can get to that place and work from there, and that's where I'd like to go, to get to that common ground. Joe actually brought up something there really important. A vision takes leadership, and that's different. That's where I feel a difference also with Bernard there and with Joe. And for the first time, I think ever, I was invited onto the interview panel for the Assistant National Director for Patient and Service User Engagement.
Very good.
Yeah. And that was interesting. And apparently when you have somebody involved at that level, that's outside the HSE, it changes the process. It gives a different, interesting and important angle.
That shows you huge commitment as well, doesn't it?
I think so. I think so. And maybe that's, when you're talking about what's changed, maybe that's it. It's the commitment. I'm feeling there's a commitment. I tell people I'm very cautiously optimistic.
Cautious. And you're obviously seeing some action. You mentioned action earlier on. You're obviously seeing that action coming into play. Well,
I remember being at one of the HSE conferences in Croke Park and bumping into Colm Henry and saying, God, Colm, we need a conference, from the patient perspective, with all you sitting in the audience, and he kind of looked at me and said, And then we went to Joe and said it to Joe, and it happened. I mean, that was a pipe dream.
And that was your first conference
last year? That was the first conference, and it was such a success.
Yeah.
Did you take some of the information or some of the learnings from that to implement going forward? Yes.
Yeah.
I think it was Derek at the end of the conference last year. I obviously didn't get the brief, or else I did and I didn't read it, said to me, and what would you like to see happening now, Anne? And I said, well, more of the same.
Yeah.
I can stand with confidence now in September and say, we've gotten more of the same. In fact, we've gotten more and above in terms of commitment. We have a lot of work to do. I don't underestimate the amount of work.
Yeah. And so that conference is going to be on the 24th of September this year. And people, if they're interested, it's going to be online, Joe, isn't it?
So it'll be both in person in Dublin Castle.
Right.
We'll be launching that on the website soon in terms of being able to book in to that. And building on last year, we wanted to be kind of 60-40, 60% patients and service users and 40% HSE and Department of Health people. Okay. At all levels. And I think that's a key.
Good.
Of course, we want our leaders there. But we also want the people who are dealing with patients day in, day out to be able to contribute to the conversation. So whether they're there in person or whether they're online, and it'll be free. So there's no charge to come to it. So it will be free. And we think that's an important thing, that, we don't create any barriers to anybody accessing the conference to have their say. And it is about having a conversation. It's not just about delivering speeches and presentations and PowerPoints. It is about having a two-way conversation. I think that's the important bit. I think when you were saying earlier about the number of organizations, there's a huge number of organizations in this country. My own daughter is involved in the sepsis foundation and stuff like that, because she too was a patient who had sepsis when she was pregnant, and both of them survived. And she's very motivated, and she takes me to task every day. There are advocates everywhere, and they all have a story.
Yes.
And they all have a reason they got active. Yes, everybody wants to have a say. I think the important part of the forum is that we have a space at the HSE for complaints and such like, okay? And our job is to learn from that. But the forum is about taking that learning and building going forward and improving and giving a better health service and having a health service that you can truly say is our health service, our HSE. That's the point of it. It's not a platform to complain about this or give out about that. And I don't regulate that. The chairs of the forum, who are patient advocates themselves, regulate that. I think it's important that we have that separate space where we can say, here's what we want to move on and build, while understanding and recognizing and learning from what's not been good in the past and why we're trying to change things going forward.
And I know, Anne, you said that you feel like things are changing. How are we going to be able to see them?
Wouldn't it be lovely if people working in the HSE felt proud to work in the HSE? And on the other side, if care was consistent right across the country. I know that's a mood shot, perhaps, but that's how you get towards a goal. You move towards it steadily. It doesn't matter what part of the country you're living in. And the partnership element is there. There's such a great opportunity now with the new regions to build this in from the beginning, from the foundation.
Perfect timing.
Yes. There's a lot to be scared about. But there's also a lot to be optimistic about, as I said.
And if people open their eyes and they see the benefits of it and they can see how it will work and how it will inform the services and the developments and just be open to it, really, staff, patients, everybody, and realise the impact that the patient, seeing the journey of the patient through the patient's eyes all the way along.
Yeah. The only way to see it, to see the difference, is in time, as you experience the services. Are you seeing a change in how you're dealt with and how you're spoken to and how you're cared for, in how when something isn't going well, that we respond to you better? That's a sign that the organisation is improving, but that improvement has to be informed by the patient experience. My current job is primarily around operational performance. I have a strong view that patients need to be absolute front and centre with us, evaluating how we're performing and criticising and critically evaluating how we are doing as an organisation. That's not just for managers and directors, and we all own this. It's in all our interest that it's a better service. Part of how you can see it happening is to get involved. You don't have to be a member of a big organization. All right. That's not a prerequisite. What you need is a bit of time and energy and commitment to it. There's room for everybody. There's room for the big representative organizations, the small representative organizations, and the individuals. And the best way is to get involved either at the national level and or at the regional level. And the regional level will be new. We have councils. We've got patient councils in a lot of hospitals. They've been around a while. What we're trying to do is bring that together as a proper network.
Yeah, so this is going to be a joined up approach and everybody will have doing the same type of thing, because there is pockets of patient involvement in different places. And what a support for the patients as well to have that network, really, and resource.
Exactly. And we are rolling
Learn from each other and
learn from each other.
We're rolling out the Better Together framework, which is a training framework for staff to help them to partner better. What are the kind of key things you need to do? We need partnership. We need that culture to be ingrained from the point at which someone decides they're going to work in the health service, whether they're going to college to become a nurse, a doctor, a therapist, or a manager, because everybody has a role in dealing with their patients. Everybody. It's not just the realm of clinical people. It's everybody that you meet along this, whether you're applying for a medical card, whether you're going to the front desk in a hospital or a GP or a primary care centre. We all have a role in engaging and respecting and making people feel like, one, we care, and two, this is their service.
Absolutely. So, Joe, we have a lot of information, and Anne, we have a lot of information here, and it's all really inspiring, I have to say, and it just sounds like an amazing way to go forward for the HSE, and fingers crossed we'll stay on that track. And Joe, just to sum up there, was there anything that you wanted to say?
Why are we doing this? Go back to the original question. When the population, when the people of this country own the health service, when it's their health service, and it's not this paternalistic thing that's this big corporate monolith, people will be more engaged, more interested, and I think more interested in their own health, and will own their own health. And when you're more invested in that service as doing it, I think people will live the messages. Will live the messages about, healthier living. Will live the messages about being involved and being active. I mean, being active in this space is actually physically active as much as it's anything else, because, you're getting up, you're getting involved, your brain's working, your body's working. It's an important part of being an active part of the forum and owning your own health service. And we think that's why we're doing this. We want people to feel it. If I just had a little example, go back to 2012 with the Olympics in London and the love affair that the British public had with their NHS. Things are a little different now there, but that's where we want to be. We want people to really, really own the HSE.
Yeah, our HSE. So, Anne, we're going to give you the final word on this podcast today. Was there anything else that you wanted to add?
I'd go back to my own lived experience again. And I knew we had to engage in research now, to evidence-based research to prove this. But I knew in my heart and soul that care coordination for this condition would work. It would benefit not just the health and well-being of the child, but also of the mother and therefore the family. And that's exactly what happened. It was informed by that lived experience, which is unique. And it's only, again, when you put those two expertises together that you can get the very best outcome. So our families, there's 250 of them now go through the clinic in Crumlin. And it's amazing. It's absolutely amazing the service that they're getting with an absolutely wonderful paediatrician, Dr. Kelleher, and our care coordinator. So I suppose I'm in the happy position of having seen this all come to fruition. And I know it can be done on a bigger scale. And I know that the outcomes will benefit everybody's health and well-being, not just the patient and service user, because when I listen to the health service workers like Dr. Kelleher, they're happy that their patients are happy.
Of course.
It boosts their morale because they don't have it easy either.
Well, it sounds like you're helping them every step of the way, Anne, with the partnership that's happening with the patients at the moment. So listen, thank you very much, Anne, for being with us today, and to Joe as well. It's been really, really informative. And we can see from that overall the patient partnership plays a crucial role in empowering patients and fostering a sense of community and driving positive change in the HSE, really. We just want to remind our listeners that we will have a conference, patient partnership conference, on the 24th of September this year, and you'll be able to find out all of the details on hse.ie. To all our listeners, thank you for your continued support, and please share this episode. If you'd like to find more information about HSE Health and Wellbeing, have a look at our website at hse.ie, Health and Wellbeing, and follow us on X. Take a look at our Health and Wellbeing YouTube channel, or register for our e-zine by emailing healthandwellbeing.communications@hse.ie. Thank you very much for listening.